Good night. My name is Marion Spencer, and I am an MPH student at the University of Florida. And today I will be talking about the outbreak of Chikunguyna, otherwise known as CHIKV, in Jamaica in 2014. So a little bit about the history of Jamaica. Jamaica is a very small island located off the coast, 90 miles off the coast of Cuba in the Caribbean. Its population is approximately 2,890,000 people, 299 as of 2017. Jamaica is broken down into different parishes, which are similar to like states here in the US, and they have urban cities, which I will be going into further discussions about areas that were impacted by the virus. So on the western part of the island, there are cities such as Trelawney, which is located in Falmouth, Hanover, which is located in Lucy, and Westmoreland, and Montego Bay, which is also located in St. James. Montego Bay is a very highly tourist area, and also it's one of the larger cities in Jamaica, which its population is 110,000 people as of the census in Jamaica in 2011. There's a total of 472,000 people or more living in those 4 parishes in total, and this is as of 2017. The areas, there are some areas that are larger than others. However, there are also dense areas as well due to overpopulation. So with that being said, they are more susceptible to viruses such as like chikungunya or mosquito-borne disease like the dengue fever, and so on and so forth. So CHIKV came to Jamaica. Its first case was noted in July 2014, and it was at the hospital, Trelawney Hospital, which is in Trelawney. However, there was no other cases until in August. So CHIKV virus is a mosquito-borne disease, and its association, how an individual would know some of the symptoms involved is severe joint pain, fever, rash, headache, backache, muscle pain, nausea, as well as fatigue. During the survey that was done, it was reported that 100% of the cases of CHIKV had fever, which is a symptom, the defining symptom of CHIKV. The disease is transmitted via person to person after the bite of an infected mosquito. The onset of the illness occurs usually within 4 to 8 days, but some range from 2 to 12 days. This varies because the nature of individuals who live in Jamaica, it takes them a while to go to the doctor. They normally wait sometimes 2 to 3 days after having the symptoms before seeking medical attention. So this the onset had to be delayed 2 days for the study that was done for those reasons. The uniqueness of the virus is that it's not common in the western part of the world. This is often in areas in African countries, and also there is no immunization for the virus, and there's also no cure for the virus. The virus also, the symptoms I should say, often last sometimes weeks, sometimes months, individuals, and which is normally the pain, but this varies due to individuals' history of other co-occurring disorders, such as joint pain or individuals who have back pain. So CHIKV is also a class 1 notifiable disease, which class 1 viruses have to be reported, and in this case it had to be reported to the Ministry of Health in Jamaica, and it had to be done by a public or private health facilities in Jamaica. As I said, the initial case of CHIKV started in July 2014 in Trelawney. However, it was August 2014 that the first 2 cases came in Montego Bay, and that was what alerted officials, public health officials, that there's a concern. The highest cases of CHIKV was reported in October 2014. That was when they had their highest numbers. There was no reports of the why it increased that time, but that was the time when the Ministry of Health and the government also issued a state of emergency in the country, and this was due to the impact that individuals who suspected that they had Chikunguyna populated the hospitals. The hospitals were overpopulated, and thinking back, I remember individuals were on the road waiting for help, the side of the road waiting for help. Medical offices were filled. Pharmacies were out of medication due to how people seeking help for the severe pain that they were having, and also the other symptoms of the fever and the nausea. Some individuals experienced diarrhea, and it really had an impact on the countries, which led them to declaring a state of emergency. So the methods that were used, the study design that were used was a retrospective cross-sectional study, because they already had the symptoms and everything, so they had to go back to see what was the cause of everything that was happening. So in those 4 parishes, they chose individuals from the 4 hospitals that are located, because each parish has a hospital, so they chose individuals from those parishes, as well as other health facilities, including clinics and private practices, which are like doctors' offices, to participate in the study. And in the criteria for participating is you have to have also lived in the 4 parishes, and also if you receive any kind of public or private health center services or hospital within the time frame of July 2014 to December 2014. In the entire country, there was a total of 5,180 cases of CHIKV that was notified to the Ministry of Health, and in the study there were 609 clinically defined cases. There were no lab confirmation for the CHIKV virus. However, they had to use the case definition, which was also in association with the World Health Organization's criteria, the WHO, and it was in relation to patient who has acute onset of a fever of 38.5 degrees Celsius and with severe arthralgia or arthritis, and which is not explained by other medical conditions. This was the criteria that they used for the epidemiologic standards of the outbreak. So as a result of these persons meeting this criteria, the Ministry of Health started to look at the dates of onset, and as I said before, they had to use the date of the review instead of the date of onset, because due to patients, participants I should say, not seeking help at the time of onset, so they had to change the time frame to the date of review as the date of onset. So with regards to the epi curve, the largest number of cases were reported during the week 37 of the virus to week 40 of the virus in 2014, which the highest number was week 38, and this was 180 cases reported during that week. Afterwards, there was a slight decrease. In week 38, there was 120 cases. Sorry, in week 39, there was 120 cases. In week 40, there was 130 plus cases. And week 41, there was 130 cases. The distribution was skewed to the right to match the western hemisphere of the country, the western section of the country, because they were mostly impacted. They had higher numbers of the virus, the virus. So also with regards to the person that it affected, women were affected more than men. There was 62% women, 37% men, and there were multiple reasons why it was so, and this had to do with the fact that factors considered were like unemployment rates. More women are home, more women are in areas where inside the home where mosquitoes are, and also like men are at work. So those were the factors that were considered why women were impacted at almost 2 times the rate as that of men. There were kids who were impacted as well. 3% of children under the age of 2 were impacted, as well as 4.6% of individuals over the age of 65 also reported cases of CHIKV. The age group that had the highest number was age 18 to 45. So the study also discussed about individuals who had pre-existing conditions, as that of cardiovascular disease and diabetes, back pain, and it was reported that the likelihood of having specific symptoms, any specific symptoms, did not differ when it comes to individuals without cardiovascular disease or diabetes, except those in back pain. The odds ratio for contracting the virus for individuals with back pain was 2.5%. Sorry, 2.5 times higher than those who didn't have back pain. So of the category of CVD and diabetes, back pain stood out as you had a higher chance of getting the virus. At the end of 2014, the beginning of 2015, there was a huge decline in the virus, with only reports of less than 7 cases of individuals who had it. And this was due to multiple measures that were taken. As I said, there was no cure, or is no current cure. There's no immunization for CHIKV at the moment. However, there were preventive measures that individuals had to take, and this includes the symptoms of you had to